Hi, welcome to our lower limb rehabilitation circuit. This is for rehabilitation for anything with your lower limb conditions or injuries. It will normally last for about 6-week sessions. Each exercise will be 2 minutes long, so try and do as many repetitions as you can in those 2 minutes. If you need a break, that's absolutely fine. Just try and rejoin the exercise afterwards. We're going to do a warm up and a cool down before and after the exercises, just to reduce any risk of injury. And it's normal to feel muscle ache after doing the exercises. That's just your body getting used to doing them. Okay, so this is the warm-up, guys. So it's just something to start getting your heart rate up a little bit before we do some of the exercises. So we're just going to start with a nice marching on the spot. So if you can, try and do it at the same pace as me. If you need to do it a little bit slower, then that's absolutely fine. We'll try and lift those legs up a little bit higher if you can as well. Okay, and then you're going to start to tap your legs out to the side. And again, try and do it at the same pace as me if you can. Okay, and then you're going to tap your legs in front of you, so you're going to dig your heels in. Okay, and then you're going to come high and you're just going to kick your bottom as high as you can. Okay, and then you're just going to warm up your calves, so just a couple nice and quickly if you can, the same speed as me. And we'll just do a few arm circles to make sure your whole body's warm. Okay, so after the warm up, each exercise is now going to be 2 minutes, okay? In between each exercise, I want you to pause it and just take a minute break if you need to.
Okay. So our first exercise is called the glute bridge. For this exercise, you'll be lying in this position with your knees bent, feet firmly planted on the floor, your head and your shoulders are rested, nice and comfortable, hands on the floor, and then you've got to lift your bum up as high as you can, like so, and coming back to your starting position. Okay, if you feel that's uncomfortable, just adjust the position of your feet a little bit, find a comfortable position, and we're doing this for 2 minutes, guys. So just down, up, go at your own pace, lift as high as you can, squeeze your bum muscles, and back down. And keep going. So we're doing this for 2 minutes. If you start feeling tired, take a little break. It's normal to feel this in your hamstring muscles, the back of your legs, your bum muscles, and even in your core. Keep going, guys. Just a few seconds left, I think.
Okay, so the next exercise is going to be straight leg raise. So that basically means lifting your leg up nice and straight and getting a nice contraction or a bit of muscle use through here. Okay, so what we do is get your knee pushing down first. You activate this muscle group called your quadriceps. Toes come up and then we lift. We don't want to lift all the way up here. We want to come to about here and then back down again. You can hover above the mat or you can go straight back down after each one. Let's just see how we feel. Okay, are we ready? So we go. As you get on, you will get some muscle ache from here, so you can just take a little breather for 1 or 2 and then come back into it. So you can do a round of 5 if you want with your lifts, and then you can come down and do a couple of ups and downs. If you want to progress it, you can hold it, or you can go a bit quicker and then slower on the way down. So you just do it as you feel, but to begin with you need to keep your leg nice and straight no matter what you do, okay? And you will get muscle ache doing this type of thing, it's normal. Okay, again, take a little breather. 1, 2, 3, and then up and back in. Now 2 minutes does feel like a long time when you're doing this. Completely normal because it's a very isolated exercise. And a little breather and back in. You want to keep that leg nice and straight every time with your toes up. Again, switch everything off, bring it back in, and up we go. Okay, you're 2 minutes up, guys.
Okay, so this next exercise is a sit to stand. So you can either do it from your chair, your sofa. When it's a smaller height, then it's harder for you. So if you need to start from a little bit higher off your bed, then that's fine as well. So what you're going to do is you can either hold on or with your hands across your chest. Keep your knees sort of shoulder width apart, and you're just going to come really slowly all the way up. Squeeze your bottom cheeks at the top, and then you're going to come really slowly all the way down. Okay, so we're going to do that for 2 minutes. Okay. So make sure you're activating your muscles as you're doing this exercise. So you're squeezing your bottom cheeks all the way in at the top. And then as you come down, you come really slowly. Try and control your movement. Don't let your knees fall in or fall out as you're doing the exercise. Now you can, if you want to, make it a little bit quicker. Or make it even harder, so your bottom is only just touching the chair and then you're coming back up, so you're not sitting all the way down. See what you feel works best for you. So if you need a little break halfway, that's absolutely fine. And then carry on. Or if you need to push up from the chair to support yourself, then try and make sure you're using your legs to do most of the work if you can. So we've got 30 seconds left. So don't try and rush through the last bit, keep it nice and steady. And that's 2 minutes, well done guys.
Okay guys, this next exercise is called a heel raise. Find yourself a step, or go to the bottom of your stairs, step up onto your step, okay, and just shuffle back a little bit so your heels are hanging off the step, like mine now, okay? Try to hold on to something for balance, like a banister, okay? And go up onto your tiptoes, and then slowly let your heels drop as low as you feel comfortable until you feel a stretch. And now we're doing this for 2 minutes, okay? Lowering down nice and slow, all the way to the top, feeling a squeeze in your calf muscles. It's going to start burning after a while. At that point, just take a rest and then carry on. Okay? You can go a little bit deeper if you feel comfortable, then all the way to the top. Or if you feel that it's too difficult, just a small range of motion like so. We're going to have a little break, step off, okay, and when you feel ready, step back onto the step, and again. Little break again. Okay, shake it off. And back onto the step. Okay, that's 2 minutes done, guys. Well done.
Okay, so the next exercise is a squat. So a lot of people get worried about the squat, but it's something we do every day. So I'm just going to show you a nice basic squat. So you just want your feet and toes pointing to 12 o'clock. You want a shoulder width. Okay, and then we're just going to do a basic squat. So you bend your knees, stick your bum out and down we go. That's almost like a medium to mini squat. And you can come in a bit lower if you want to. Okay, I'll show you that from the side, guys, so you can see what I'm doing. Again, nice and straight with the toes, and then we'll just come down. Okay, so we're going to do this for 2 minutes. Okay, rest that time. Let's go. Okay, so some people like to put their hands here, I like to put them here. Okay, just reminds me to bring my body forward a little bit as I'm squatting. As you're coming down, again, I'm sticking my bum out a little bit, getting a nice bend in my knees as they come over my toes. If we do it from the front, you want to keep a nice gap and then down they come. Okay. Might want to take your feet out a little bit wide if they're feeling a bit close. Toes to 12 o'clock and down we come. You want to get them in line as well. Mine went quite in line. If you want, you can go a little bit lower if you're feeling like you want to push it a little bit, or just keep it as a mini. When you come up nice and straight, and back in again. Okay, nearly done. Keep it going. Yep, stop it there, guys.
Okay, so the next exercise is heel to toe walking. So it's something to test your balance a little bit. So what you're going to do is put put one foot out in front of you, put your heel down first and to your toe, and then put your other foot so your heel is in front of your other toe. Okay? So, we're going to start 2 minutes. So try and do it maybe along a line on the floor. Okay, if I just show you from sideways on as well. So heel to toe. And if you need to put your arms out to balance, that's fine as well. Or if you need to do it along your kitchen worktop, just to help you balance so you don't fall over, that's fine too. Okay. So you're just carrying on heel to toe, holding on if you need to. It's a really good thing to try and get your balance back to normal. If you want to, you can make it harder by doing it on a couple of pillows in front of you, but that's 2 minutes.
For this next exercise, guys, this is called a lunge on a step. Okay, so we're going to lead with one leg. Okay, it doesn't matter which one because we're going to alternate. You're going to bend the front leg as far as you feel comfortable. You're going to go back to where you started, and you're going to switch legs. Bend as far as you feel comfortable. Switch legs again. You can hold on to your banister if that makes it more comfortable. And you don't have to worry about your balance. Go as far as you feel forward with that knee, and keep your heels firmly planted on the step as well, and switch. And again. Keep going. It's normal to get a little bit out of puff with this exercise. And switch. If you want to make the exercise harder for yourself, don't hold on to anything. Okay, and switch. You're bending your front leg, and the leg that's behind you, try to keep that one nice and straight. Alright guys, that's 2 minutes.
Okay guys, so the next one is a hamstring curl or bending the knee. Okay, so I'll just show you first. We're going to do this for 2 minutes. So it's literally just bending up and back. Now if you've got a bit of restriction on your knee, you're not going to get up that far, don't worry. It happens, yeah. You'll eventually get there as you open up any restriction in the knee as you go through the classes. Okay, if you wanted to make this harder, you can go quicker, or you can hold up in that position and down, or you can put a small weight around the ankle, or something that's going to go around your ankle to make it a bit harder, okay? Eventually, as you get through this, you will get some little bits of muscle cramp or spasm in the hamstring, completely normal. You'll have a little bit of muscle ache after this as well, normal, okay? If you wanted to, you can compare to your other side, just to see if your affected and non-affected sides are any different, and then try and aim for that. What I don't want to see is this. want to see your knees nice and parallel and up. Okay. I've got holes in the bar next to me, so you can do this next to your kitchen counter if you want. You can use your banister if you're happy at the bottom of your stairs, or something like a sideboard, anything at all, just for your balance. You might want to take a little breather for a couple of seconds because you've got all your weight on the other leg. That can get a bit achy and then get back into it. Okay, keep it going, we're nearly there. All done.
Right. So this is crossover walking. So basically the right leg crossover to the left, left over to the right, more like a scissors action. Okay. So just like that. Right to the left, left to the right, right to the left, left to the right. Same way. Left. Just keep going for about 2 minutes. This works well, it helps with your balance as well. Just try and keep it in a straight line as well.
Okay, so the next exercise is stepping up. So on your bottom step at home, holding onto the banister if you need it, you're going to step up with one leg and then step up with the other. Okay, so we're going to do that for 2 minutes, okay? So nice and slowly and controlled. Try and keep your knees facing forward as you do it. If you want to make it harder, you can go a little bit quicker. Or if you want to progress it even further, you can try and do it without holding on. And lifting your other leg up. So try and keep that balance. If you need a break, you can have a break for a second and then just restart again when you're ready. So whichever way you feel is comfortable or which is easiest for you, have a go at doing it that way. Quite a good one at getting your heart rate up as well as strengthening through your legs. Okay, that's 2 minutes.
This next exercise is called toe taps. So you are reaching with your toes, tapping the floor in different directions. Okay, so I want you to go forward, then I want you to go to the side, then I want you to go back, and then switch legs. Forward, side, back. We're doing this for 2 minutes, okay? Put on some nice music, and then get tapping. Back, forwards, to the side. Switch legs, okay? It doesn't have to be exactly in this order. You can go sideways, like this, okay? You can do a few forwards, do a few backwards, and make your own little dance, okay? Stepping different directions, testing your balance, and also getting your heart rate up as well at the same time. And that's 2 minutes, guys.
Okay guys, so the next one is crab walk. So crab walk sideways, so that's what we're going to do. So we're getting into a little bit of a little mini squat, and then we're going to go sideways. Okay. Then we're going to come back in. We're going to keep that little squat, and over we go. Okay. And then back over this way. So you can go as far to the left or right as you want. Okay, and if you wanted to make this any more difficult or a bit more resistance in, we will put on a lovely TheraBand. So, your physio will supply you with one of these. Remember, make sure it's nice and tight. When you tie it on, put it around the knees. So then you've got some resistance pulling in. Okay. So again, back into squat. And then we just do exactly the same with the band, giving some resistance. And back over. You can make it more difficult by coming down into the squat a bit more as you go. Taking bigger steps. There's lots we can do here. Okay. Now I'm only moving short distance so you can see me left and right. You can do this longer. Okay. And then we can go back to nice and easy ones. Just depends on your level. So you do it at your level. Okay. And sometimes you can get a bit of clicking around the knee when you do this. Don't worry too much. You will get some ache as well. It's all going to be new first time you do this, so don't worry if it doesn't feel great. Okay. There we go. Okay, all done guys?
Okay, so the last exercise is single leg balance. So at home, ideally you want to do it without your shoes on to get some more feedback from your ankle and your foot. And if you're doing it on your kitchen surface or anything that's slippy, then doing it without your socks on, just so you're not slipping about as well. So you're just standing on your injured or affected lower limb. And if you want to make it harder, either take a ball or a cushion and pass it around your back and around your front. Okay. And then around the other way. Okay. And all this time you're trying to keep balanced on that one leg. Okay. Now if you want to make it even harder, you can take a pillow or a cushion put that in front of you and then do the same thing, but just standing on that. Just means you've got a bit of an uneven surface, so your ankle's having to work harder to keep balanced on that one leg. So with this one, if you find that it's just a bit achy, just have a rest for a second as well. If you want to do it at home, then you can do it on the other leg to make sure you're equal through both. But obviously this one we're trying to focus on your affected leg. Okay, if it's too hard without the ball, you can, with the ball, sorry, you can put the ball down and just have a stand on that leg, and you can do a little dip down in the leg if you want to make it a little bit harder without the ball. Again, if you need to, you can put your arms out to help you, or if you need a chair or a kitchen worktop next to you to hold on to if you need it, then that's fine too. Okay, 2 minutes.
Alright, so this is the last bit of the group. We're just going to do a cool down. So I'm just going to start with one leg in front of the other, back leg straight, bend that front knee, just put your arms out in front, and then we're just doing a calf stretch here, okay? Alright, and then that back leg, try and bend the knee a little tiny bit, just to get your lower calf muscle, your soleus. Okay, I'm going to hold that for a few. Then we're going to swap around the other way, so arms to the back. Okay, I'll show you this from the side. So, back leg is straight. And then we just bend that back leg a little tiny bit. Okay, keep yourself up nice and straight. Next one we're going to do is for your hamstring. I'll show you this from the side as well. So just ground leg out in front. Bend the knee a little bit, just stick elbow out. Now I've got my toe up at the end. If you're feeling it's a bit too tight, put your toe down and then bring them up slowly to where you're comfortable. Alright, I'll show you that from the front as well. And then we just swap our legs over. And we do the opposite leg. Remember, warm down is just as key as warming up. It reduces your risk of injuring when you're doing things outside of the class, okay? Next one is your quads, guys. Big muscle group here, so we're just going to bend up. So some people don't have the amount of flexibility in the knee to do that, so there's other ways of doing it as well. So from the side, you could just do a couple of kick-ups here. You could also put a towel around the foot and just pull up and stretch if you wanted to. Okay, but for this circumstance here, I'm going to show you this. We're going to do that type of stretch. We're going to do both legs. Okay, you can hold it for a couple of seconds. If you can't get that far, don't worry, you can put a towel around here and just pull instead, okay? I'm just going to do a little bit of a stretch for the top half, just move a little bit round from the back, okay? Because we use our back in everything we do, so doing a little bit of stretching after a long end is good, okay? And just hold it